a doctor, a scalpel, and a decision no one would ever dare to imagine. In the frozen wasteland of Antarctica in 1961, a young doctor named Leonid Rogozov suddenly developed acute appendicitis. No colleagues, no airplanes, no rescue. Only him and death drawing near. Writhing in unbearable pain, he realized there was only one way to survive: to perform surgery on himself. This story is not a legend, but a chilling truth in the history of medicine. Before we begin, comment below. Would you dare to do what he did? The winter of 1961 marked the coldest period Antarctica had seen in decades. The sky was gray and the wind howled like clashing metal. The temperature dropped so low that boiling water could freeze within seconds. In the middle of that desolate wilderness, across endless white fields of ice, a small group of Soviet scientists worked at a research station called Novolazarevskaya. There were only 12 of them, and only one had medical expertise, Dr. Leonid Rogozov, then just 27 years old. Rogozov was a young, intelligent, and ambitious surgeon. He had been sent there to care for the health of the entire team and to study the effects of extreme cold on the human body. During the first days, life at the station was peaceful. They worked, ate, talked, and endured weeks-long snowstorms together. But everything changed after one evening. Rogozov began to feel abdominal pain. At first, he thought it was just indigestion from canned food. He kept trying to work, but the pain grew more intense. His body temperature rose, cold sweat poured out, and his heartbeat quickened. When he pressed his hand on the lower right side of his abdomen, he immediately understood what was happening. With the experience of a surgeon, he realized he had acute appendicitis, a condition that could lead to death if not treated surgically in time. The entire research station fell silent. There was no hospital, no other doctor, and no way to contact the outside world. All means of transport were blocked by blizzards. No planes, no ships, no escape. Death was drawing closer with every minute. Rogozov knew better than anyone that if his appendix burst, he would die in unbearable pain, and no one could save him. In fever and despair, he had to face the coldest truth of all. He was the only doctor there, and the only patient there was himself. The blizzard swept across Antarctica more violently than ever before. The entire research station was engulfed in a thick white haze, the wind howling like the roar of a wild beast. The metal walls trembled with every gust, and everyone inside knew they were completely isolated. No plane could reach them, no rescue signal could be answered. They were buried alive in the coldest place on Earth. In his small room, Dr. Leonid Rogozov lay curled up, the pain in his lower right abdomen growing unbearable. He knew time was running out. With every passing hour, his appendix swelled larger, the pressure inside his abdomen rising, and if it burst, blood and pus would spread through his body. Then he would die in agony within hours. His colleagues, who had no medical training, looked at him in despair. They tried to send distress signals by radio to nearby stations, but all they received was static and cold silence. Rogozov understood better than anyone. No one could save him but himself. In his journal, he wrote a few short but chilling words. "No one can operate on me. I have to do it myself." He wrote nothing more. After setting down his pen, he quietly looked around the room. Scalpel, scissors, clamps, sutures, all the tools he once used to save lives would now be used to cut into his own body. The stabbing pain in his abdomen made him sweat cold, but his eyes remained determined. He stood up and looked out the window, where the snowstorm was swirling as if it wanted to devour the entire world. There was no turning back, no hope from the outside. Only one choice remained: operate or die. In the small, freezing room of the research station, Leonid Rogozov began preparing for something no doctor had ever done before, performing surgery on himself to save his own life. There was no time to hesitate. He turned the modest room into a makeshift operating theater. Every surgical instrument was neatly arranged on a metal table: a scalpel, scissors, clamps, gauze, and suturing needles. He boiled water, sterilized each item with alcohol and steam, his hands trembling but precise. Every movement he made was not just a medical procedure, but a battle against fear and the primal instinct to survive tearing inside him. Two of his colleagues, a meteorologist and a mechanic, stood silently nearby. They had never witnessed anything like this, but Rogozov calmly instructed them on what to do. One would hand him instruments on command, the other would hold a mirror so he could see his abdomen. His voice was deep and slow, but firm. No one objected. They all understood. This was the only chance to save the life of the one person who could provide medical care for the entire team. Rogozov prepared the anesthetic himself and injected it into the lower right side of his abdomen. The pain was still there, but he didn't let it stop him. When the drug began to take effect, he changed into surgical clothes, put on gloves, and lay on his left side so his inner organs would shift to one side. The dim light reflected off his pale skin. A small mirror was placed beside him to observe the incision, but the cold air and his breath quickly fogged it up. He took a deep breath and looked around the room one last time. Everything was eerily silent, except for the howling wind outside and the pounding of his heart in his chest. He picked up the scalpel, its steel glinting faintly in the weak light. The clock showed 2 a.m. Rogozov whispered, "Begin," and the blade touched his own flesh. The first incision was chillingly precise. Not a single sound, only short, shallow breaths and the pounding of a heartbeat echoing in his ears. Leonid Rogozov was fully conscious. He knew every movement of the scalpel. 1 millimeter off could mean his death. The dim light cast a pale glow on his ashen face. Sweat began to fall, drop by drop, onto the cold white surgical gown. The air was thick with the scent of antiseptic and blood. Midway through, a wave of pain surged through his abdomen, nearly causing him to pass out. His vision blurred. 2 colleagues stood nearby, men who had never touched a scalpel, trembling as they watched him struggle to go on. Rogozov paused for a few seconds, took a deep breath, and whispered to himself, "Calm down, stay calm." He kept cutting, finding his way by the feeling in his fingertips. He could no longer see clearly in the mirror fogged by the freezing air. Only instinct and survival experience remained. At last, the tip of the scalpel touched what he had been searching for: the appendix, swollen, inflamed, tense, ready to burst. He knew that one wrong move could rupture it, flooding his abdomen with deadly toxins. But his hand kept moving, trembling yet precise. He clamped the blood vessels, cut, and then stitched each layer of tissue under the dim light. When he noticed a dark spot, a sign of infection, he immediately cleaned and disinfected it with an alcohol solution. His body trembled, his vision dimmed, but he continued. After 1 hour and 45 minutes, Rogozov tied the final stitch, looked at the closed wound, and whispered, "It's done." Then he collapsed in that small, ice-covered room, where a doctor had defeated death with his own hands. When Leonid Rogozov woke up, the pain still lingered, but his breathing had stabilized. The faint light filtered through the frost-covered window. He reached out and gently touched the stitches on his abdomen, the same hands that, just hours before, had saved his life. His colleagues beside him could not believe their eyes. They had witnessed a man surpass what medicine called impossible. After just 1 day, Rogozov was able to sit up, check the wound, and even take careful notes in his medical journal, as if it had been a routine surgery. He could eat, speak, and his spirit gradually returned. On the 5th day, he removed the stitches. His body began to recover so quickly that no one could have imagined it in the harsh conditions of Antarctica, where any wound could become infected within hours. 2 weeks later, Rogozov stood at his desk, continuing his work as a doctor. He did not allow himself to rest or let the event become an obsession. For him, it was simply a duty, a life or death decision that any doctor would make if there were no other choice. But for the outside world, it was a miracle. His story quickly reached the Soviet Union and then spread around the globe. Doctors everywhere were astonished. An ordinary man, without assistance, in minus 40 degrees Celsius cold, had performed a complex surgery on himself and survived. Rogozov's operation became a legend in medical history, a testament to the extraordinary power of the human mind, skill, and will to survive when faced with the boundary between life and death. Leonid Rogozov never saw himself as a hero. When asked about the surgery that astonished the world, he simply replied, "The work needed to be done, and I did it." To him, it was not a miracle, but merely an instinctive act of survival. But to the world, it was living proof of the almost limitless strength of human will. Though he survived, Rogozov never truly escaped the memory of that night. He often woke up in the middle of the night, drenched in sweat, feeling as if the scalpel was still cutting through his own flesh. The nightmares returned again and again. The sound of metal against the operating table, the cold scent of antiseptic, and the dim white light inside the frost-covered room. He continued his work, but deep in his mind, that memory never faded. Colleagues recalled that after the event, Rogozov became more withdrawn. He rarely spoke about himself and avoided mentioning the past. But sometimes, during meetings, his gaze would drift into the distance, as if he were seeing again that small room amid the blizzard, where he had fought death with his own hands. Many years later, when the story became widely known, Rogozov was praised as a symbol of extraordinary courage and resilience. Yet he never accepted that title. To him, it was not heroism, but duty. A doctor must never give up, even when the patient is himself. Leonid Rogozov's story remains a powerful reminder that courage does not always come from shouts or glory. It is the silent moment when a person faces their deepest fear and still chooses to keep fighting, even if only to preserve one more heartbeat. Leonid Rogozov's story remains a powerful reminder that courage does not always come from shouts or glory. It is the silent moment when a person faces their deepest fear and still chooses to keep fighting, even if only to preserve one more heartbeat. Today, the story of Leonid Rogozov is still remembered as one of the most terrifying testaments to the limits of human endurance. He had no modern equipment, no support team, no anesthesiologist, only a knife, a mirror fogged with breath, and an unyielding will. In an age when medicine depends increasingly on technology, Rogozov proved that the greatest power does not lie in machines, but in the heart and spirit of a human being. When faced with death, he did not pray for a miracle. He became his own miracle. Later, medical historians called his surgery the miracle at the end of the world. But to Rogozov, it was not a miracle. It was duty. The duty of a doctor, even when the patient is himself. The final entries in his diary still send chills down the spine. "I feel as though I have seen both life and death at the same time, and I chose life." Leonid Rogozov passed away in the year 2000 at the age of 66. But his spirit lives on, in every surgery, in every life that modern medicine continues to save. His story reminds us that sometimes courage does not lie in gunfire or on battlefields. It lies in silence, when a person in the middle of a blizzard holds a scalpel, trembling, and dares to fight his own body to stay alive. If you believe that humans can achieve things far beyond their limits, comment "I believe" below. And don't forget to subscribe to the Doctor's Secret Files, because sometimes the hidden medical secrets are the very things that will keep you awake tonight.